My name's Neil Fenn. I'm a consultant neurological surgeon at Swansea Bay University Health Board and HMT Sancta Maria Hospital in Swansea. I have a specialist interest in Uro-Oncology, mainly prostate and kidney cancer. So the vast majority of prostate cancers are called an adenocarcinoma of the prostate. There are rarer histological subtypes, but the vast majority will be that histological subtype, and they develop from the glandular component of the prostate gland. We know that prostate cancer is age-related and common. However, 90% of men diagnosed with prostate cancer will still be alive and well at 5 years. And that's mainly due to advances in diagnoses, staging and treatment. So when we look at prostate cancer, we know there are a number of well-documented risk factors that can be associated with the development of the disease. The first is age, so that as we progress on in age, the risk of us having a cancer of the prostate increases to the extent that 3/4 of all prostate cancer patients are over 65. And then if you go looking for prostate cancer, that 80% of men in their 80s will have a prostate cancer somewhere in their prostate. However, the vast majority of those age-related prostate cancers are not clinically significant or unlikely to ever need any treatment. Then we have family history. Family history is particularly important if you have a first-degree relative such as a father or brother, or a second-degree relative such as an uncle who have developed prostate cancer at an early age, and we define that as less than 50 years of age. And if that was the case, that certainly would put you at an increased statistical risk. And it's thought that between 5 and 10% of all prostate cancer cases are actually related to this genetic link that may occur. Then we have ethnicity. So we know that Afro-Caribbean men are at an increased risk of developing prostate cancer compared with Caucasian men, and then Asian or those of Chinese heritage have the lowest risk of developing prostate cancer. And finally, of course, there's lifestyle changes. One of the things we know with all cancers is that high body mass index or obesity can be associated with the development of cancer, and prostate is no different to that. When we look at prostate cancer diagnosis, in fact, many patients these days will present before they have a significant group of symptoms. We've already mentioned lower urinary tract symptoms, but sadly they are not disease specific. So whether you've got benign enlargement of the prostate, prostatitis or a prostate cancer, all those patients will share a common set of urinary symptoms. What we do have in prostate cancer is a opportunistic screening for prostate cancer. So patients who are concerned or may have some minor urinary symptoms will go and see their general practitioner, and they may well have a digital rectal examination, as we've already discussed, or a blood test called a PSA. This is so-called case finding of prostate cancer before significant symptoms. There are, of course, patients who do develop symptoms which point us in the direction of prostate cancer. So that will include things like pain on voiding, will include blood in the urine, or particularly in the ejaculation. Sadly, there will be a significant number of patients who don't present at an early stage with their disease, and the disease is already at an advanced stage. And they will tend to present with some generic type of symptoms such as weight loss, loss of appetite and fatigue. And they may also present with some specific symptoms such as bony back pain because of the spread of the cancer to the spine. If you start to develop the symptoms we've spoken about, or you're concerned with your family history about the risk of prostate cancer, the question is, what should you do next? Well, I think this is very straightforward. You have your family doctor or general practitioner, and that would be your first port of call. I'd suggest that you make an appointment to see them. They're likely to take a history and perform an examination, including a digital rectal examination. They will arrange some simple investigations, such as a kidney blood test, a prostatic specific antigen, a prostate blood test, as well as a urine test to rule out any infection. If after the assessment with your general practitioner does confirm that you have an abnormal feeling prostate, or your PSA, or prostatic specific antigen blood test, is elevated, then your general practitioner will refer you on a urgent suspected cancer pathway for further investigations.